listening. I'm sure everyone here is pretty grateful to have this opportunity to engage with you. I'm going to try and keep it brief because there's a lot of people here.
And I don't know whether it's a clock. Normally I will try and announce when we're getting close. But yeah, thank you for being wary of that, because yesterday we had some people that kind of got long-winded. It's embarrassing for me to go. So thank you for...
You got to get the hook.
Yeah. I will let the audience give you the hook if you go too far.
My name is Andrew Killian. I'm a resident and a registered voter. Last year I moved to Hamilton to be a caregiver for my mother, who was diagnosed with terminal cancer. I was there every step of the way. I was there for the x-rays, the consults, the operation, the recovery, the false alarms, the chemo, the counselors, the panic attacks, the quiet moments. I bathed, clothed, and fed her. I managed her pain until it was too great. I admitted her into hospice, where she stopped eating, stopped drinking, and then withdrew from the world. I was there when she died. The care my mother received was exceptional. It was all thanks to Medicaid, a government-run plan. Because of Medicaid, care was not denied. Care was not delayed so a for-profit insurance could search for a pre-existing condition and cancel the policy. We did not have to contend with skyrocketing premiums. And because of Medicaid, costs were not prohibitive to the point of bankrupting our family. And for that, my family is grateful. Now, as I understand it, the public option is a plan for the 47 million uninsured American people, just like Medicaid. I support the public option, just like 73% of all Americans. Will you do everything in your power to make the public option a reality?
Wrong statistic.
Thank you for giving your personal experience. And I think probably all of us in here can give personal experiences as well. My mother with her cancer. My mother-in-law who passed away with her cancer. One of the things that I've done over the years, and we can't all be involved in every service group, but if we ever did away with a volunteer like yourself who came to help your mother, or the organizations that stepped forward to volunteer, I just happen to have been the chairman of the Montana Muscular Dystrophy Association for 3 years, because it's one of those issues that I think is very important. Youth muscular dystrophy is terminal. And so I eventually became the national vice chairman. Not one single government dollar is spent on muscular dystrophy. And that's what Jerry Lewis is all about in the telethon. I'm a Shriner. I don't know how many Shriners there are in here. I've been to every hospital in the nation, both burn and orthopedic, volunteering my services, working with the fundraising that occurs. And I only give that example because if we ever did away with volunteerism and the charity and the desire and the ability of Americans to help those in most in need, this country would implode. Government cannot do everything for everyone. Medicaid was set up for the low income. It's money that's taken out of the taxpayer's pocket. And it serves a very important function, as does Medicare, which is a tax that we pay along the way. But being in government service and public administration, I have to deal on a daily basis with the inefficiencies within the government as well. Whether it's in the Veterans Administration, Medicare, Medicaid, you name it, CHIP, and in health. There are the same level of inconsistencies, waste, fraud, and abuse as there are within the insurance industry. And I've always wondered why we would take a healthcare system that provides some of the best cancer care in the nation and take a problem that exists with some people, myself included on occasion, with the insurance industry, and suggest the government can do a better job, a more efficient job. See, because in some cases, not in the case of Medicaid, when you're on a government system, but when you have and do business with an insurance company, if you have choices, which many people do not, and that's one of the things we can talk about with healthcare, If you do not have choice, then you're stuck with your carrier. They may cancel you, they may do something with pre-existing condition, but that can be addressed. And if we have more competition, we can pick and choose among the various companies, and if somebody's not treating you appropriately, get rid of them, change companies. And that's what we need to work to. Because if we have an inefficient, uncaring government, what are you going to change to? You got one choice. You got one government. We don't get to go to something else. And so what we really need to do is we need to create more opportunities. Make more opportunities to create competition. And I'm no fan of the insurance companies. I mean, frankly, I've had some really knockdown, drag-out fights with them saying, you're setting yourself up. You need to change. You need to work with us. Create more opportunities. Let me give you one quick example. Since I was elected in 2000, I got there in 2001, the Republican-controlled House continually passed something called Association Healthcare Pooling. What is that? Well, currently, if you do business with Geico, you can buy auto insurance from a lizard across state lines. But you can't buy health insurance across state lines because there's a federal law that precludes you from doing it. So let's say you belong to the Montana Association of Realtors. You belong to the Wyoming Association of Realtors, and you belong to the Washington, Seattle, Spokane Association of Realtors. The three of you associations cannot team up together to pool, to go out and have insurance companies compete for your business. Why? Because Blue Cross Blue Shield of Montana is a separate company than the one from Wyoming and the one from Washington, and they fight it. They opposed it. They defeated the legislation in the Senate every time. So when they say, you Republicans, what's your solution? We've had solutions. We can't get it through a Senate where we didn't have the 60 votes to end the filibuster to get them to pass something that would actually help us come closer to better health care coverage in this country. The same with tort reform. This bill, this represents the number of pages in the health care bill. Let's make it, or empty. I wouldn't print it out because that would be an unnecessary expense, but that's how many pages this bill has. Not one single page addresses trial errors. Not one single page addresses defensive medicine. You talk to your doctors. You talk to your hospital. You talk to the administrators and the trustees of that hospital, and they will tell you defensive medicine occurs. If we're going to get serious about solving this healthcare crisis, then we need to get government in some ways out of the way, allow us to pool, allow us to have to get a doctor can practice medicine without having to worry about the fear of lawsuit. And they fear it. So, I'm not unsympathetic. Like I say, we've all dealt with government and private industry in healthcare crisis. We've all lost family members, parents and grandparents and spouses. Everybody in this room. But I don't see how it gets us any closer to quality health care by requiring a public option is going to compete and ultimately drive the rest out of business and ultimately ration health care, because that's what's happening in the veterans industry. That's what happens in the I give an opportunity to try.
But isn't 47 million uninsured people, isn't that basically rationing care? And furthermore...
Okay, all right.
And my second point is, you said options. We should have options. We should have choice. And wouldn't a public option be a choice for people on the lower end of the spectrum? People who are working poor, people who have two jobs and take care of their kids and can't afford health care.
Until such time that the public option has driven every other option out of business. Now, ultimately, if we want to talk about the 47 million, let's talk about the 12 million that are included within that, which are illegal immigrants. Let's talk about the number of people within that 47 million who are the youth who do not want to be covered. Let's talk about within that 47 million the rich who don't need to be covered because they have health savings accounts. And so there are a number of people that are uninsured within that number. Are we going to destroy the best healthcare system in the world?
It is.